Situation 17. Nurses in all practice areas are likely to come in contact with clients suffering from acute or chronic drug abuse. Question 81. The psychodynamic therapy of substance abuse is based upon the premise that drug abuse is a common problem brought about by socioeconomic deprivation. B. Caused by multiplicity of factors. C. Predisposed by an inability to develop appropriate psychological resources to manage developmental stresses. D. Due to biochemical factors. Answer: B. Question 82. Being in contact with reality and the environment is a function of the A. Conscience. B. Ego. C. Id. D. Superego. Answer: B. Question 83. Substance abuse is different from substance dependence is an substance dependence. A. Includes characteristics of adverse consequences and repeated use. B. Requires long-term treatment in a hospital-based program. C. Produces less severe symptoms than that of abuse. D. Includes characteristics of tolerance and withdrawal. Answer: D. Question 84. During the detoxification stage, it is a priority for the nurse to A. Teach skills to recognize and respond to health-threatening situations. B. Increase the client's awareness of unsatisfactory protective behaviors. C. Implement behavior modification. D. Promote homeostasis and minimize the client's withdrawal symptoms. Answer: D. Question 85. Commonly known as shabu is A. Cannabis sativa. B. Lysergic add-diethylamide. C. Methylenedioxy, methamphetamine. D. Methamphetamine hydrochloride. Answer: D. Situation 18. It is common that client ask the nurse personal questions. Question 86. Anticipation of personal questions is given adequate attention during which phase of the nurse-patient relationship? A. Orientation phase. B. Working phase. C. Pre-interaction phase. D. Termination phase. Answer: B. Question 87. The client asks for the nurse's telephone number. Which of these responses is not appropriate? A. It is confidential, I just don't give it to anyone. B. What would you do with my number if I give it to you? C. If I say no to your request, what are your thoughts about it? D. Are you asking for an official number of the hospital clinic for your reference? Answer: A. Question 88. When the client asks about the family of the nurse, the most appropriate response is A. Avoid the situation and redirect the client's attention. B. Give a brief and simple response and focus on the client. C. Why don't we talk about your family instead? D. Introduce another topic like the client's interests. Answer B. Question 89. When the nurse is asked a personal question, which of these reactions indicate a need her to introspect? A. The client is simply curious. B. Her right to privacy is being intruded. C. The client knows no other way to begin a conversation. D. Some patients are like children in seeking recognition from the nurse. Answer D. Question 90. It is 10 o'clock of your watch. The client asks, "What time is it?" The nurse's appropriate response is A. Are you bored? B. It is 10 o'clock. C. Why do you ask? D. Guess, what time is it? Answer B. Situation 19. Ricky is a 12-year-old boy with Down syndrome. He stands 5'1" and weighs 100 pounds. He is slim and walks sluggishly with a limp. He wears a neck brace as support for his neck. X-ray of cervical spine showed subluxation of CI in relation to C2 with cord compression. He attends a school for special education. Question 91. The classroom teacher consults the school for guidance on how to take care of Ricky while inside the classroom. The nurse considers as priority Ricky's A. Physiological needs. B. Need for self-esteem. C. Needs for safety and security. D. Needs for belonging. Answer C. Question 92. Ricky's mother visited the school nurse. She asked, "What should I do when Ricky fondled his genitalia?" Appropriate response of the nurse is for the mother to A. Divert Ricky's attention and engage him in satisfying activities. B. Tell Ricky that it is wrong to keep fondling his genitalia. C. Ignore Ricky's behavior because he will outgrow it later. D. Engage him in computer TV games that engage his hands. Answer A. Question 93. The nurse has one-on-one health education sessions with Ricky's mother. The mother understood that for her son to learn to cope and be independent, she should constantly provide activities for Ricky to be able to A. Socialize with people. B. Eventually go to school alone. C. Select and prepare his own food. D. Do activities of daily living. Answer D. Question 94. All of the following activities are appropriate for Ricky except A. Working with clay. B. Competitive sports. C. Preparing and cooking simple menu. D. Card and table games. Answer, B. Question 95. Ricky's IQ falls within the range of 50 to 55. He can be expected to A. Profit from vocational training with moderate supervision. B. Live successfully in the community. C. Perform simple tasks in closely supervised settings. D. Acquire academic skills of 6th grade level. Answer, C. Situation 20. The abuse of dangerous drug is a serious public health concern that nurses need to address. Question 96. The nurse should recognize that the unit primarily responsible for education and awareness of the members of the family on the ill effects of dangerous drugs is the A. Law enforcement agencies. B. School. C. Church. D. Family. Answer, D. Question 97. A drug dependent utilizes this defense mechanism and enables him to forget shame and pain. A. Repression. B. Rationalization. C. Projection. D. Sublimation. Answer, A. Question 98. This drug produces mirthfulness, fantasies, flight of ideas, loss of train of thought, distortion of size, distance and time, and bloodshot eyes, due to dilated pupils. A. Opiates. B. LSD. C. Marijuana. D. Heroin. Answer, B. Question 99. The nurse evaluates that her health teaching to a group of high school boys is effective if these students recognize which of the following dangers of inhalant abuse. A. Sudden death from cardiac or respiratory depression. B. Danger of acquiring hepatitis or AIDS. C. Experience of blackout. D. Psychological dependence after prolonged use. Answer, A. Question 100. The mother of a drug dependent would never consider referring her son to a drug rehabilitation agency because she fears her son might just become worse while relating with other drugs users. The mother's behavior can be described as A. Unhelpful. B. Codependent. C. Caretaking. D. Supportive. Answer, A.